So good morning or good evening, everyone, wherever you are. Thank you very much for joining us. It's a great pleasure to participate in this event and have two real experts when it comes to cyber threats against the healthcare centers. So thank you very much also for the introduction. And I would like to start with Timo-Pekka. Timo-Pekka, given your impressive experience and your current role as Finland's CISO for the social and healthcare system, what are the threats and trends that you see facing that the healthcare sector faces?
I feel that the environment has changed during recent years. Before, there was more like an individual hacking as a revenge after getting some bad experience in healthcare as a patient or employee. But now I feel that since all those identity thefts has become so common, and this healthcare information is good source for that kind of information. So now actually we are target of really professional attackers who also have resources because they are investing money to get back selling information. So there is no hobby attackers anymore, they are professionals.
Okay, thank you very much. So almost moving from individual to very organized attacks that you see right now. Well, asking a very similar question to, or the same question to Wim, who's got an equally impressive biography, and he's currently the managing director of the Dutch healthcare center's CERT, the Z-CERT. What kind of threats do you see facing the healthcare sector, looking also, for instance, at new technology that might potentially be abused by criminals? Wim, the floor is yours.
Yeah, okay, thank you, Philip. I think we see things that's also been seen in Finland and other lands and other countries around the world. We see an increase of phishing attempts, so things like CEO fraud, things like that, but also misuse of, let's say, vulnerable applications. So at the moment, we see a lot of what we call RDP scans. So RDPs are our remote desktop protocol, which are currently quite intensively being used by employees from healthcare organizations to work remotely from home. So this is a bit worrying, to be honest, because if this is the first entrance, so if they are hacked or misused, then it's the first step to enter the internal infrastructure of a healthcare organization. So it's challenging at the moment.
Thank you, Wim. So you mentioned RDP attacks, obviously getting remotely into those healthcare, into those systems in hospitals, and you mentioned also CEO fraud.
Yeah.
Have you seen ransomware? Is that a threat that you've seen as well?
Not that much in the Netherlands. We've seen a few attempts, but they luckily weren't successful. So, but we heard from other certs in other countries in Europe as well as in the States that there were successful ransomware cases. Some of them used, for instance, vulnerabilities in the RDP protocol, or sometimes they were using other methods to get into the organization. So we haven't seen a big one in the Netherlands, except for a university, so not a hospital, or it was the Maastricht University. And on the same, let's say, in the same city and very close to the university is also a hospital, which is called the Universal Medical Services of Maastricht. So they work very closely to the university. So it was quite close, that attack. But the organization itself, the healthcare organization itself, wasn't hit. Okay,
so that's actually good to hear. It reminds me, because obviously we've been looking at ransomware attacks quite intensively, and to Timo-Pekka's point on those criminals becoming more organized, we had one group that very kindly announced that they would spare, during the COVID-19 crisis, they would spare hospitals from ransomware attacks, and if they would get hit, they would actually give them the keys to decrypt their data. which is kind of bizarre if you think about it. I mean, they do work like corporations, and they have their PR messages ready as well. Now, just mentioning COVID-19 and Wim, have you seen any changes under the current, in terms of the threats against the healthcare sector? Have you seen any changes?
During the COVID-19 situation, well, as I mentioned, quite an increase in phishing attempts, but they were all more or less related to let's say, financial fraud attempts, and a lot of scanning of let's say, vulnerable protocols. So that's kind of a wake-up call for us, that we weren't the ones that did the scans, so we don't know who's scanning those organizations, but it's quite worrying, just because of the fact that a lot of our constituency members are using RDP to let employees work from home.
Right.
And there are also medical offices. For instance, we've seen that radiologists using artificial intelligence applications from their home to help patients, and those let's say, applications are well, they can be, let's say, they can be used by from a distance by this RDP protocol. So we decided to let's say, increase our own scans looking for vulnerable protocols. So we haven't seen luckily major incidents, but we're quite scary that this will happen in near future because of the digitalization of let's say, the medical process we're seeing right now in the Netherlands. So the use of artificial intelligence, but also the use of electronic patient files, which is increasing in the Netherlands.
Okay, so that's quite a good point. So given that we are getting more, we're all getting more, online, obviously because of the crisis. Criminals are getting online as well, and combined with what you just described, which is obviously an ongoing process to digitize all our key processes, and using AI-based systems. I think that's get you correctly. That really creates a broader and a different attack surface. To Timo-Pekka, so I mentioned COVID-19. Have you seen any changes during the crisis in the attacks and threats against the healthcare sector?
Actually, surprisingly little. Of course, there has been, in general, attacks, and network usage has increased, and there has been technical problems. But on the other hand, I have not seen so much just COVID-related or healthcare-related attacks now. Maybe we are just lucky, or maybe we are not capable of finding them, or also possible. But in general, we have had not very much big problems. No.
Okay, so that's actually good to hear. But you're right. There's always this aspect that do we know what we don't see, or the knowns, unknowns, whatever the expression is. But it is true that we probably have not full visibility of what's really going on. Now, just moving sort of, as we only have 15 minutes left, and I could probably speak for hours with the two of you, given your expertise and insights. But from your, and I'll start with you, Timo-Pekka, from your standpoint, what you see, what is it that we need to do? How can we prepare ourselves better for those changing threats and trends, specifically looking at the healthcare sector? What, in your opinion, what is still missing? What is it that we need to do better?
As said, these attackers have more organized now. So we should be more organized as well. So we should be better split different tasks from different officials. Hospital takes care of the door, police takes care of the street, and an army takes care of the border. It's quite natural in the physical world, but we should be able to do something similar in the cyber world also, so that the hospital don't need to take care of this.
I lost you at the end there, but I think the key message is we need to have that network, if I got you right, to defend against a criminal network really, and you know, hospitals or individuals should not be left alone in this battle. Wim, turning to you with the same question, what do you think we need to do better? What is missing? What are the gaps? And how can we become better in our fight against those threats against the healthcare sector? I mean, you mentioned you know, AI systems. Is that something that can help us also?
Maybe. Well, like Timo Pekka said, I think we should organize ourselves not only as let's say professionals or peers to share the lessons learned, but what we're trying to build in the Netherlands is also what we call a healthcare detection network. Within the heart of the network is a MISP server where we let's say share indicators of compromise on a daily basis with all the healthcare organizations like hospitals or healthcare and addiction care organizations, mental health and addiction care organizations. So this is more or less a machine-to-machine network. So that's also a way of let's say fighting against the criminals or the bad guys. There's also one other thing I'd like to mention, and that's one thing we're looking at right now. We let's say looked very good at how the financial services industry is addressing cybercrime, and we've seen that let's say they do a lot of, let's say, testing, not only pen testing but also red teaming. And we think this is also a good idea if organizers start using this kind of tests, resilience testing. So we're trying to make them enthusiastic about those tests, and we'd like to help them to facilitate those tests. Okay,
thanks, Wim. I mean, I think that also resonates with me. I mean, to learn from other sectors, you know, see what the best practices are, replicate them, and we don't have to reinvent the wheel. But sort of summing up it, because I think that's all the time we have. You know, it was great to hear what you saw, what the trends, what the threats are, what the changes are also. But I think on a positive note, what is it, you know, that you're already doing, which is quite impressive, but also what we can do, you know, in addition to that. So with that, I would like to thank you, Wim and Timo Pekka. It's been a very weird panel for me, but it's a great pleasure to meet you online. And thank you very much for having this discussion and for joining us. Thank you very much.
Thank you for sharing. Thank you. Bye-bye.
Thank you. Bye.
Bye.